Well, September is National Ovarian Cancer Month, and unlike other forms of cancer, doctors say there's just not as much awareness for this potentially deadly disease.
And we know so many people have stayed away from the doctor's office during the pandemic with some fears of maybe catching COVID-19. And now officials say as things are starting to change and be a little bit safer, it might be the time to prioritize making those yearly annual visits.
Yeah, Fox 59's Nick McGill is back right now. He spoke to a local oncologist who has this very important message for people. Nick?
Yeah, that's right, guys. About 20,000 cases of ovarian cancer are diagnosed each year. Now, that's just a fraction compared to those diagnosed with other diseases like breast cancer. But doctors at Hancock Health say they're still hoping to raise more awareness about the disease and how early testing can lead to better outcomes. According to the American Cancer Society, women have a 1 in 78 chance of getting ovarian cancer in their lifetime. That may be a small percentage, but for that small percentage, it matters. Unlike breast cancer, ovarian cancer is hard to detect. There's not a test you can perform at home, and most ovarian cancers, when they're found, are many times more advanced and already beyond the ovary. So how can you stay ahead of the disease? Like so many others, early testing is the key to prevention and better outcomes. But doctors at Hancock Health also say being aware of potential risk factors goes a long way.
It tends to be a disease of older women. This is pretty rare under the age of 40. The average age for women in this country to diagnose is around 63. There are genetic factors. If you have a relative, if you know your mother had the disease, your sister had the disease, grandmother had the disease, because they're a hereditary risk, they should make sure they're connected well with their primary care physician or their gynecologist.
About half of women who were ultimately diagnosed with ovarian cancer end up reporting symptoms of pain or abdominal bloating. There's also symptoms of fatigue, nausea, or a change in bowel habits. If these symptoms persist, that may be a sign it's time to talk to someone.
We all have aches and pains. You and I, we have aches and pains, something we ate, something something that's there for hours, days, we kind of ignore it goes away. But symptoms like that are there for weeks at a time, a month, that warrants a trip to your primary care physician or your gynecologist.
Now, there isn't an absolute way to prevent the disease unless a woman has genetic testing done, is deemed to be at risk, and then has prophylactic surgery to remove the uterus and the ovaries. Bottom line, though, staying on top of the yearly exams is crucial. According to Dr. Schultz, if there's still a number of women out there that have continued to put off their annual exams or their mammogram, so he wants to use this moment to urge them to get reconnected with health care. In the studio, Nick McGill, back to you.